For now, these graves in Brazil's largest city, Sao Paulo, remain empty. Whether they'll stay that way is looking less certain every day.
There's a sense of fear in Brazil. There's an economic instability, a health instability, and also political instability. And this altogether is the recipe for a disaster when you have such a dangerous virus going on.
The largest country in South America has seen a rapid rise in infections and deaths, and now has the third most cases of coronavirus in the world, behind just the USA and Russia. Lack of testing has led experts to believe the epidemic is much more widespread, and the vast disparity of wealth in this country of more than 200 million has thrown up unique challenges to tackling the threat of COVID-19.
Brazil is a very unequal country, much more than Russia, United States, and especially more than the UK. So it's a very unequal society. And in terms of, for instance, urban infrastructure, it's way poorer than those three countries. In Rio, you have only 50% of the city has basic sanitation. You have cities in Brazil, major cities in Brazil, they're poorer than Rio, where you have only 60% of the people have access to water in their house. The cities in Brazil and the low-income neighborhoods, they tend to be much more dense than in cities in Russia, or UK or the US. In terms of hospitals, we have major problems. There was one study that we did that showed that 10% of the population in Brazil lived in regions where you don't have one single ICU bed or respirator. 10%. 56% of the population lives in areas where they don't have enough ICU beds to address the already existing problems. So imagine with the pandemic. So if we're not using smartly the comparative advantage we have, and we have those structural flaws, so big structural flaws, I fear that we'll have a major and tragic situation, much more than Russia, the UK, or the United States.
This week, Brazil recorded its highest daily death toll so far, the grim tally topping more than 1,000 for the first time. In total, the country has lost almost 19,000 people to the virus. Despite the escalating mortality, unlike in the UK, where until recently the measures to contain the virus were implemented nationwide, Brazil's states and municipalities have always made their own rules. And a cavalier approach to the coronavirus from Brazil's president, Jair Bolsonaro, has further complicated the separate states' attempts to tackle the virus.
In terms of national policy, we don't have anything. It's really the local governments are doing some kind of restrictions, sometimes stronger, sometimes softer. And the federal government is saying that we should not harm the economy, but the economy is already harmed. So, and it's fighting all kinds of local government policies in terms of speech, but also in terms of action.
Worst hit is Brazil's largest city, Sao Paulo, where the situation in this metropolis of 12 million people is fast becoming desperate. Sao Paulo's mayor has told reporters the city's health system is nearing collapse, saying 9 out of 10 beds are full. The situation in Brazil's other urban centres is similarly dire.
We're seeing many cities collapse, many hospital systems in cities collapse. So we saw this in Manaus. We're seeing now in Rio, that is close to be happening in Fortaleza and all major cities.
Miguel stresses that although Brazil is lacking in hospital care, there is a strong primary healthcare system in place, which could be used to help mitigate the spread of the virus.
So Brazil do not have the possibility of producing tests or buying tests. However, we do have a primary healthcare system that works really well, that covers 70% of the population. So we could be using this primary healthcare system in order to identify people that have symptoms of COVID and people that have contact with the people that have symptoms with COVID. But this will require a lot of capacity of coordination in a continental country. And this is something that this government has shown that it doesn't have. It doesn't have any ability to do any kind of coordination, to send a clear message in a moment of crisis.